Okay, today we're going to do an NG tube insertion. So I am gathering my equipment, I'm grabbing my towel to place on my patient, grabbing an emesis basin just in case they do vomit. I am grabbing a 14 to 16 French tube. I'm grabbing a tegaderm to reinforce it. I'm grabbing my tape to tape it to the nostrils, grabbing my measuring tape, pair of gloves, a water soluble lubricant, and then water to offer the patient. And I am going to start by checking my doctor's orders, checking my client care plan. I'm going to gel in and then knock. Hi, my name is Sierra. I am a nursing student from Fresno City College. Can you tell me your name and date of birth?
Cheyenne Garza, 0403-2000.
Okay. I am providing privacy. Hi Cheyenne, I am going to be inserting an NG tube to give you all the nutrients that your body needs so we can start healing. Since you are NPO right now, I'm going to raise my bed to a comfortable working height. I'm going to elevate the patient into a high Fowler's position unless contraindicated. I am going to start by assessing my vital signs. I am going to apply a pulse ox to my patient. I'm going to check for lung sounds and bell sounds. And then I'm going to start by examining the mirrors. So I'm just going to shine a light into your nose to look at both sides, okay? So I'm looking, I'm not noticing any cuts, abrasions, or bleeding coming from them. And then now I'm going to check for the patency. So I just need you to breathe in and out of your nose, and I'm going to plug one side at a time, okay?
Okay.
Okay, both the nares are patent, and I'm going to choose this one that's closer to me. So I'm going to start by grabbing my materials. I'm going to make sure my medicine and my water to offer the patient is right next to them. I'm going to apply this towel to her, and then, okay, I'm going to make sure I have my 14 French, and then I'm going to open it. I'm going to reach in and grab my little box to put my water-soluble lubricant in. I'm going to remove this since we're done assessing vital signs. And then I'm going to put on my gloves. Then I am going to grab my 14 French. And now I'm going to measure from the tip of the nostrils to the earlobe. And then I'm going to measure all the way down to the xiphoid process. Okay, I have my marker now. I'm going to mark it with a piece of tape. Now I'm going to wet it with my water soluble. I'm going to make sure it's about 4 inches lubricated so we could insert it. And now I'm going to go and start to insert it up and then slightly downwards. And then the patient's going to start to gag as you reach the throat area. So I'm going to pause now. I'm going to grab my pen light. Can you open your mouth? I'm checking to see if I can see the tubing in the back of the throat. I can, it's not coiled. So at this time I would offer the patient a drink of water to start helping them go down so they could swallow their water as we're doing this to make it more comfortable. And then I'm going to start inserting it at a 90-degree angle, 90 to 80 degrees. I'm going to be turning it. I'm going to be inserting it at the same time. I'm going to keep inserting it until I reach my marker. So I reach my marker, and now I'm going to hold it. I'm going to grab a piece of tape, tape it to the nares. I'm going to apply another strap because that one wasn't so great, so I could replace it. I'm going to tape it, and then we are going to do a portable bedside x-ray. We're going to confirm the placement of the tube. It is in the right place. So now we're going to tape it to the side of the cheek to anchor the tubing now. You want to make sure that it's nice and around the tubing so that it doesn't move as the patient's moving, that it doesn't get out of place now. And then I'm going to grab my measuring tape and I'm going to measure the outside of the tubing. And then on the outside of the tubing is about 10 centimeters, I'm sorry. So now I'm going to flip it and do the inches side. It's about 5.5 inches. So I am going to check one more time in the back of the throat to make sure that I can see the tubing in the throat, that it's not coiled, that it went all the way down, checking the placement of it. I am going to notice any gastric secretions that came up during the procedure. I am going to lower the bed, keep the head of the bed elevated 30 degrees for comfort unless contraindicated. Do you feel comfortable? Is that fine for you?
I feel comfortable.
Okay, and now I'm going to start cleaning up my mess. I would provide oral care to the patient, ask if they need a sip of water, lowering the bed all the way down now, and I'm cleaning up my mess. I'm grabbing my materials, and I'm taking off my gloves. And I'm gelling out of the room, and I would document procedure, how well the patient tolerated, their vital signs before and after. I was monitoring the O2 stat, so I document that the baseline of it and if they needed oxygen throughout the procedure. I would also document if the patient needed any oral care, if they had any emesis during the procedure. Also note that the color, texture, consistency of the gastric secretions that came out. And then that's it. Thank you.